We're going to start the program. So those of you, I'm sure all of you have at any given time been visited by OSHA on your inspections. So we're fortunate to have a representative of HIOSH, our local organization that does the inspections of the property. His name is Alan Yamamoto. He's been with the department he's in right now. He's been with them for 14 years. And he'll talk about, obviously, about HIOSH and what their role is in the community and in our industry. But also, and then I think I mentioned in the previous meetings before that currently our hotel is under consultation. And, you know, Alan can talk a little bit about that along with the many other things that their department does in the community. So, no further ado, Alan, you can come up and.
I'm going to try and not use this. Can everybody hear me if I don't use this? If I speak in this tone?
Yeah, we can use it.
You can talk. Then I don't know how loud to talk. Why don't we try without it first?
Yes.
Okay.
No.
Okay.
No.
Okay. Okay, Alan.
All right.
Okay.
I've got a no over here. So.
Okay.
All right. My name is Alan Yamamoto. Sorry. My name is Alan Yamamoto, and I'm a health consultant with HIOSH, the Consultation and Training Branch. Did everybody get a handout?
Yes.
It'll be a lot easier if you guys follow with the handouts. Oh, she needs one. Somebody get her a handout. I know we got a couple extras.
This one you mean?
Yes.
Okay.
All right, everybody good?
Okay.
All right. Today we're going to be talking a little bit about who HIOSH is, what we do in terms of inspections, what standards are applicable to housekeeping departments, and specifically I'm going to focus on bloodborne pathogens and hazard communication. A little bit about training, and then what resources are available to you. So how many people have had HIOSH inspections or OSHA inspections? Almost everybody. All right. The first question we always get whenever we come into an establishment is, you're from where? HIOSH stands for Hawaii Occupational Safety and Health, and we're a division within the state's Department of Labor and Industrial Relations. We are the state equivalent of federal OSHA, but we also do something that federal OSHA does not do. We run a consultation and training program which provides training, outreach, education, and assistance. OSHA was created in 1970 when Congress passed the HIOSH Act of 1970. In doing so, they gave the states the opportunity to create their own program, in which case Hawaii did so in 1974. The stipulation was that the state program had to be at least as stringent as the federal OSHA program. Both HIOSH and OSHA have the mission of creating safe and healthful working conditions. How do we do that? Well, we promulgate workplace safety and health standards. We enforce these standards through inspections. We issue citations and penalties for non-compliance, and then we provide training, outreach, education, and assistance. The law that gives us our power can be found in Chapter 396 of the Hawaii Revised Statutes, and the standards that we enforce can be found in Title 12, Subtitle 8, Parts 1, 2, and 3. All of this information is available on our website. Our enforcement branch, they do two types of inspections. They do programmed inspections and unprogrammed inspections. Our programmed inspections consist of the list. This is what some people refer to as hit list. Every year what we do is we randomly, or we don't randomly select, we select high hazard industries. Not necessarily high hazard businesses, but we select industries that have higher injury and illness rates than state or national averages, and then we target those industries. We then randomly select businesses within those industries, and that's how we get our inspection list. When we're not doing programmed inspections, we're doing unprogrammed inspections. These are complaints, referrals, investigations, accident investigations, follow-up inspections, and discrimination investigations. If HIOSH comes to your door, you can expect a site entrance, an opening conference, document review, walk around, and employee interviews, not necessarily in that order, and then a closing conference. And I'll go over these real briefly. During the site entrance, the inspector will verify that he or she is in the right place. They'll identify themselves as a HIOSH inspector and show their credentials. And they'll request to speak with a top management official. So it might sound something like this. Hi, is this the outrigger Waikiki? It is. Good, it's your lucky day. My name is Yamamoto. I'm from State HIOSH, HIOSH, and I'm here to conduct the general schedule inspection. So meet with your top management official. The question we get after you're from where is, do you have an appointment? All of our enforcement investigations are conducted unannounced. And we know when to show up the worst time. At the site, during the site entrance, or anytime during the inspection process, you have the right to deny entry. It is private property, and you can't tell the inspector to get lost. If you do so, though, he or she may come back with a search warrant. Like I said, no, the other thing that you can do is you can have them wait for up to an hour. Like I said, we know when to show up, the worst time, when everybody's out, nobody's there. If everybody's at a meeting, we give you the opportunity to call them up, ask them if they want to come back, or if they want to designate somebody, or and we can wait up to an hour. During the opening conference, the inspector will provide the reason for the inspection, state the scope of the inspection. We have two scopes. It's either a comprehensive or a limited. A comprehensive is basically where we're going to look at everything wall to wall. A limited inspection is where we're only going to focus on certain areas. Most times, complaints may be a limited inspection, which meaning they'll only focus on the complaint items. And then they'll explain the inspection process, which is what I'm going through now. The document review, the inspector will look at the OSHA 300 logs. They're going to look for trends. They're going to look for problem areas. They're going to review all your OSHA mandated programs and review training records. During the walk around, they're going to walk through the premises, identify and document potential violations, and this may include taking pictures and monitoring the environment for health hazards. And they'll also speak to employees. Why do they want to speak to employees? Well, they need to determine what hazards the employees are exposed to. They need to assess what training has been provided, whether proper policies and procedures are in effect, whether proper PPE is being provided and used, and address employee questions and concerns. During the closing conference, they'll explain the alleged violations, they'll establish abatement dates for uncorrected violations, and they'll explain your rights and responsibilities, which is the informal conference and contest, and I'll get to that on the next couple of slides. Following the inspection, citations may be issued for willful, repeat, serious, other than serious failure to abate violations. Penalties may be assessed up to $77,000 for each violation. Each violation must be corrected, and you have the right to disagree with any citation, penalty, or both. That's handled through our informal conference and contest proceedings. The informal conference is an informal meeting between the inspector, their supervisor, and whoever the company chooses to bring on their side. And you informally discuss your disagreement. If it's you don't agree with the citation, you don't agree with the penalty, or if you would like the penalty reduction, those things can happen at the informal conference. If you're not happy with the results of the informal conference, you always reserve your right to contest that particular inspection, citation, or penalty. What happens in contest is it goes before a labor relations board, and it's a hearing. It's a 3-panel hearing, and it's more like a court setting where each side tries to prove their side. We always recommend that if you can settle your differences during the informal conference, you do it that way first, and then if you're not happy, then go to contest. It saves everybody the headache, time, and money of hiring lawyers, although not required, and going through that process. Having said that, you do have the right to jump directly to contest. And then follow-up inspections may also be conducted. All right. For 11 and a half years, I was the inspector. I was the bad guy. No, I'm not. So, some helpful tips. Be courteous. Smile on the outside. Curse, cuss, all you want on the inside, but be courteous. It's okay to disagree with the inspector, but make sure you have a discussion with them. You don't get into an argument. One day during the walk around, I was walking through the offices, and people have the weirdest things that they have in their own cubicles. I'm sure you guys have weird things in your cubicles. One thing that I came upon in particular was a sign that said this. I didn't particularly enjoy it, but I know other people who do. So, have a discussion with them. It's okay to walk away disagreeing, that you save that for the informal conference and the contest proceedings. But don't get into an argument with the inspector. And then try to remember that it's nothing personal, unless you guys make it personal. It's nothing we're just people trying to do our jobs as well. All right, that's all the stuff that we do on the enforcement side. What I wanted to do is go over the standards that are that apply to you guys. Whenever we come to housekeeping departments, there are two particular standards that we always address. The first one is bloodborne pathogens, and the second one is hazard communication. For those of you who are not familiar with bloodborne pathogens, the bloodborne pathogens standard applies whenever you have employees with occupational exposure to blood or other potentially infectious materials. Occupational exposure is defined as reasonably anticipated skin, eye, mucous membrane, or parental contact with blood or other potentially infectious materials. It's widely accepted, especially in the hotel industry, that housekeepers do have exposure to bloodborne pathogens, among other departments. So now that we know that you guys do have exposure, this is what's required. You guys are required to have an bloodborne pathogens exposure control plan. Now what this plan will do is it'll set up an exposure determination. It'll determine who is covered by the program. It'll state how you plan to protect the employees, the methods of compliance, HPV research labs, that doesn't apply to you guys, hepatitis B vaccination, post-exposure evaluation and follow-up, and communication of hazards to the employees, that's their training and record keeping. And also the procedure for evaluation of circumstances surrounding exposure incidents, so incident investigation. The other thing I forgot to mention about bloodborne pathogens is it is our nitpickiest standard that we have. And the plan must be reviewed and updated at least annually. So at least every year it needs to be reviewed. If there's changes to be made, then changes need to be made, which is why we always look for a review date. If there are no changes to be made, then you can just put an initial or signature, review it on, what is today? November 12th, no changes to 2014, and just initial that off. The exposure determination, this is who we're going to include in the bloodborne pathogens program. So housekeepers, definitely, security, definitely, I know we have something from security, and others like landscaping, maintenance, those who do plumbing, guest service agents who may take care of guests who get cut on the beach or something like that. All of these people would be covered by the bloodborne pathogens program. And then a list of some job classifications where only some employees have. So if you group all of your maintenance people into one group, then maybe only the plumbers will have bloodborne pathogen exposure. Methods of compliance, using universal precautions. This is the assumption that anything containing blood or if visible that may look like blood is contagious. It does have HIV, HPV, or other bloodborne pathogens. This is a requirement. Engineering and work practice controls. This is how we're going to protect the employees from getting exposed to blood or other potentially infectious materials. In housekeeping and for the hotels, I've seen it done in two major ways. The first one is that we're going to train everybody. All of our housekeepers are going to be trained and they're going to know what to do in the event they walk into a room and there's needles, there's blood on the sheets, there's blood on the towels, things like that. They can handle it themselves. The other method is if you want to have a response team. So therefore, when the housekeeper walks in and they see any one of these things, they're going to call for the response team, and their only other job is to secure the room. Either way is fine. It's completely up to which way you guys want to do it. When you're writing these procedures, though, what I do encourage you to do is start from discovery. So an employee walks in, and they see blood. What do you want them to do? And I list out the steps. Same thing goes for maintenance, landscaping when they're walking the grounds. I know a lot of hotels, they use housekeeping. Housekeeping is always their fallback because they've got all of the materials to clean up the spills or needles, things that they find. So if a landscaper is doing work and they find a needle on the premises, then what do you want them to do? Want them to radio in, or do you want them to handle it themselves? The one thing that you guys do not want them to do is either just throw it in the trash or pick up the needle and carry it to housekeeping. That's what you don't want them to do. PPE. What PPE is going to be required? Where it's located, how to put it on properly, how to take it off properly, how to dispose of it properly. Housekeeping and decontamination. This is things for like laundry. How are you going to handle soiled laundry? You guys are going to red bag it, throw it away, or red bag it, have it cleaned, things like that, as well as the decontamination process. Spraying it down with your sanitizers, things like that. Sharps need to go into sharps containers, specific containers that are leak-proof, puncture-proof, and are properly labeled. If you guys do have it where everybody is going to be responsible for cleaning up, then you want to make these things available to them. And then other regulated waste. These are your towels, sheets, things, linens, and good blood. Hepatitis vaccination. Anyone who is on that exposure determination, they need to be offered the hepatitis B vaccination. The series has to be at no cost to the employer, at no cost to the employee, and made available at a reasonable time or place. If they've already received the vaccination, ask them for documentation or something that shows that they received it. They can get it from the doctor, the date of the vaccination series, things like that. If they choose to deny or if they choose not to receive the hepatitis B vaccination, then they do have to sign a declination form. Post-exposure evaluation and follow-up. Somebody gets a needle stick. Somebody threw a needle in the trash can. Housekeeper didn't see it. They picked the trash and they get stuck. What do you want them to do? What's required to be done? This is a list of everything that's required to be done on the next two slides. It goes through documenting how it happened, trying to identify the source individual. For those of you in the hotel industry, it's a lot more difficult, especially if it's a checkout. There's no way you guys are going to be able to get in touch with the source individual. Taking a look at what the employee was doing, what PPE they had on, if they're doing anything improper, and then where you're going to send them to. If you're going to send them to doctors on call, you're going to send them to the nurse emergency room, and what's going to happen after that. Having their blood drawn, tested, providing counseling, things like that. Labels and signs. Everything that contains bloodborne pathogens or other potentially infectious materials has got to be labeled or color-coded properly. So this is the label, or orange or red bags can be used with instead of the label, as long as everybody knows what orange and red means. Training and information. Everyone also must receive training on bloodborne pathogens. And it needs to be provided initially and at least annually thereafter. There are 14 elements that need to be required, that are required to be in the training. These are the 14 elements here, and it needs to be site-specific. I'll go over that a little bit more during the training section. And the other thing about bloodborne pathogens is they need to have the opportunity to ask questions and have questions answered. Meaning you can't just show them a video, stick them in a room and say, here, watch this. If somebody has a question, then somebody needs to be available to answer that question. Because the way some people learn, if they don't get past that question, then they're not going to fully understand everything that comes after that. Record keeping, medical records, and training records. So for every exposure incident, then there needs to be medical records that are kept, and our training records, they're required to have 4 specific items on the training record. And I'll go through more to that when I talk about training. All right, we have templates that are available. If you guys need templates for anything, send me an email. My card is in this little protector here. Besides being a cool business card holder, it's also for credit cards. It will protect your credit card from getting swiped. I don't know if you guys saw in the news, but they have people that they can walk around with a wand and they wand your purse and they have all your credit card information. That's what this is for against. But if you guys need templates, exposure control plans, hepatitis B vaccination declination form, exposure incident form, this is the sheet that will provide all the incident investigation. Checklists, this is what I call the CYA checklist. It makes sure that you guys do everything that you're supposed to do as required by the standard. And it has each item and a line item, and somebody has to initial off and date that. So make sure you guys do everything. Generic training, this is non-site specific training, but bloodborne pathogens training that can hit the main points of the 13 items that are non-site specific. And then training records. All right.
Excuse me, before you go into hazard communication, I have a question in reference to bloodborne hotels. You know, in our public areas and in the women's restroom, we have, you know, those sanitary napkin containers.
Yes.
Okay. What, if any, at one time I called and I asked, how come they don't red bag them? What does HIOSH, what is their HIOSH thought when it comes to when you discard it?
We don't have anything for actually discarding, but if the employees are going to handle it and you know it's going to go down the line where somebody else is going to handle it, then it needs to be red bagged to let other employees know down the line that look, this contains or may contain blood or other potentially infectious materials.
Because a lot of times if they're not in paper bags or in plastic, they just grab it and throw it to regular trash.
Yeah.
So you've got bloodborne mixed with regular trash.
Yeah. So that could be a problem.
So at this point, there's no regulation.
No,
on that.
if it's sold with blood, then it's considered other regulated waste, and it needs to follow bloodborne pathogen procedures.
But right
So
now,
it's
if that same employee takes it, puts it with all her trash, seals it, and tosses it, there's no regulation on that at this point, right?
Yeah.
It's just that you're saying if they take that,
And
take
it
it
goes,
in another area, another employee may grab it,
Right.
and it's a problem,
Then-
right?
then it becomes
So it needs to go directly to the, whatever the big
Yes,
to dump,
yes.
right?
Oh, go ahead.
I just want to make sure they're clear on that too. If it's a blood-stained sheet, dry blood stain, that can go directly to trash.
Or whatever you guys' policy is, as long as if it's flaking, then no, that's considered bloodborne pathogen, and it's got to be, because now it's giving up and out. If it's completely dry, it's not flaking, then yes.
And then my other question was, after getting a hepatitis B vaccine, is the employer required to have them tested to see if it took?
Only for healthcare workers.
Okay, that's good.
And that's per the CDC guidelines. It says that in there.
Yeah, and CPR trained employees also qualify or mandatory to get that?
If it's going to be a part of their job duties, so you know, if it's in their job duties as a security that they need to provide CPR first aid should the occasion arise, then yes. If you provide the training, but you tell them, look, it's completely up to you guys. If you guys want to provide it, you know, in a good Samaritan aspect, then no.
Okay.
Any other questions? Oh, go ahead.
Oftentimes, those, when housekeepers are cleaning guest rooms, it's not necessarily blood that they would find, but they would find other bodily fluids
Yes.
on the sheets.
Yes.
How are they to be determined? You know?
If there is visible blood, then it needs to be treated as bloodborne pathogens. If you cannot tell that there's blood in it, then it does not. Or if you cannot tell, then it does.
How about semen?
Semen, no.
No.
But there's still the general precaution that you have gloves probably to
Yes.
pull it off, so
Yes.
you protect yourself generally.
Yeah, and this is just what the standard requires. If you guys want to go and create a policy that's beyond the standard, then more power to you. Any other questions? Can I put this down here? Everybody hear me? Okay, hazard communication. This is the other thing that we always look at when we come to housekeeping. A lot shorter than bloodborne pathogens, I promise. All right, so and this is for the new rule that came out, the 2012 GHS. So this is going to apply to any chemical which is known to be present in the work environment that employees can be exposed to. It does not apply to general household items that are used as a normal consumer would. The example I always use is Clorox. Clorox at home you use maybe once a week, one time for 5 minutes, 10 minutes. You guys don't use Clorox that way. So that's why this exception will not apply to you guys. And housekeepers normally they're using it all day, as many rooms as they're cleaning. You're required to have a written program. In that written program, it needs to address labels and other forms of warning, safety data sheets, employee information and training. And then also, if you guys have any processes that take place infrequently, maybe once a year or once every twice a year, things like that. And then, let's see. And then you also have to have a list of hazardous chemicals. That's part of the program. Normally you have an inventory of whatever MSDS is, things like that you guys are required to. Labels. For our new standard, labels are going to be required to have 5 items. You're going to be required to have a signal word, hazard statement, pictogram, precautionary statement, and the name, address, telephone number, and of the manufacturer, importer, or responsible party. If you guys choose to use your own labeling system, then you're only required to have the identifier and words, pictures, symbols, or combination thereof. That's going to let employees know what they're working with and what the hazards are. And then that coupled with the readily available MSDS or SDS will be sufficient. Safety data sheets. Safety data sheets are changing. Now they're going to be required to have 16 sections. I'm sure if you've looked at MSDSs, some of them are really good and some of them are really crappy. You can have one that's only 1 page, and then you have another one that's 16 pages. Now they're all going to be required to have 16 sections, and you need to have an MSDS for each of the items that you have. Training. Employees need to be trained on all the chemical hazards and that they're exposed to, what chemical products they're being exposed to. They should also be informed of the requirements of the standard, operations in their work area where hazardous chemicals are present, and the location and availability of the hazard communication program, list of hazards, and safety data sheets. They also need to know how to detect the presence of release in the work area. The physical hazards, simple asphyxiation, combustible dust, pyrophoric gas hazards. Most of that won't apply to you guys. The only thing that would normally apply is the physical health and maybe sometimes simple asphyxiation. And then the details of your hazard communication program. So this is where, again, we're getting into site-specific things. You can't just use a blanket training. All right. As you guys know, I'm sure you guys know, the hazard communication standard changed. These are the effective dates. By now, everyone should have received at least the training on labels, the new labeling system, and the new SDS format. If you have not, send me an email, and I'll get you the training materials for that. By June 1st, 2015, almost everything is going to go into effect. And then for the employers, by June 1st, 2016, everything is in effect in terms of the program. We're giving you an extra year to update your program, update the training on materials and data sheets if there are any new hazards, things like that come up. In between now and then, you can use either the old standard or the new standard. But come June 1st, 2016, everything's going to be in the new standard. Again, we have templates for the hazard communication program. We have the generic training available, and then we have the 2012 GHS training that's available. If you need any of that, send me an email. I'll be more than happy to provide it to you guys.